Good evening, everyone, and welcome to yet another special session on cancer care during COVID 19. I am Kamal Narayan, CEO of ISW Council, India's premier institution for health advocacy, awareness, and behavior change. With this show, we have been trying to bring authentic and useful information for effective cancer care from top experts during the ongoing pandemic. There is no doubt cancer is a fatal disease, but more than that, it is the lack of awareness and believing in unverified facts which many times lead people ignoring the initial warning signs of the disease affects patients most. Right from what to eat or do or to what not to wear or think, the range of myths surrounding cancer are abundant. Many of those suffering from cancer were told that they might have prevented the disease had they done something or not done something. Knowing the right fact is as important as the medicine itself when it comes to the treatment and care of cancer. Doctors and experts will tell you how falling for myths can affect the treatment of a cancer patient and may impact the outcomes. And to talk on this and many other aspects related to cancer care, we have a very special guest with us today, Dr. Chitresh Aggarwal. He is consultant medical oncologist, hematologist, oncologist, and bone marrow transplant expert at Alchemist Hospital in Panchkula. So, welcome, Dr. Aggarwal, on this special show. Uh, Dr. Agrawal has also been associated with Max Super Specialty Hospital in Mohali. However, before we begin our conversation, I would request our online viewers today to keep sending their questions on the comment box, and we will try to answer most of them in the next 40 minutes. Also, like and comment with your feedback, and do share this special show on your wall to help many others who may get benefited with this information. So, Dr. Chitresh Aggarwal, welcome you again. And let me also begin this show with a generic question about your take on present cancer scenario in our country and especially in the region you are practicing.
Thank you, Mr. Kamal, for giving us this opportunity today. I welcome all the online viewers for this special show. Cancer nowadays is a disease which is progressing and new cases are being diagnosed every day. Most common cancers like breast cancer, lung cancer, cervix cancer in ladies, these are the common cancers which are on the rise. And whatever region, whatever city you are practicing in, due to more awareness, due to early diagnosis, due to more advanced medical facilities now available even in peripheral areas, we find that the diagnosis of cancer is becoming common each day, and many diseases which were earlier left behind undiagnosed, or many cases which were labeled without diagnosed earlier, are now attributed to cancer, and many mortality cases where earlier we were not able to diagnose these cases is being possible now. So cancer is on the rise, and due to early diagnosis or late diagnosis and early interventions, many cases are being treated also. But as a general, this disease is on the rise in our country.
Yes, so cancer is on rise, and we are getting more cases which are diagnosed, and that's good that we are able to diagnose, cancer cases on time, and sometimes it is not being diagnosed, on time also, which is, kind of leading to more mortality or other sufferings, as you mentioned. Uh, Doctor, what has been the change due to COVID-19, and how much it has impacted the continuity of care or people's willingness to seek care during the time of pandemic?
I will give you a very practical and a very frank answer for this. If you are dealing with, non-fatal diseases like infection, diabetes, hypertension, Those cases are cases where we can afford the patients to tell that no, you don't come to the hospital, continue with the same medications, and probably a month or a 2 month later period, we will be able to see you, evaluate you, and then slight modification of the treatment can be done. But here, cancer is far more fatal than COVID-19 itself, because not every patient might be affected by COVID, but cancer is a disease which might lead to fatality in many more number of patients. So practically, we have to sit and decide on a case-to-case basis that which patients can continue chemotherapy or oral tablets or some form of therapy at their hometown or nearby hospitals. But the structure of the treatment or the confidence level of the patients and all is such that they need to frequently visit the hospital, meet the oncologist, get their reassessments done. And not many patients are, in the bracket where we can see that, yes, we have written you or prescribed you a particular treatment and you continue for 3 to 6 months period and then we'll see you later. So it is a difficult situation, especially if you see the mortality rate in cancer patients, it is definitely high because the immunity is low, chemotherapy, ongoing patients, already the immunosuppression is there, and chances of infection is very high. But that then also, it's a two-edged sword. If we don't treat them, they have a risk of death. If we call them to the hospitals frequently and treat them, then there is an increased risk for encountering COVID-19. But again, I think what we have done, or what most of the hospitals have done, is that we have strictly followed the COVID-19 protocols and tried to treat as many patients as possible with this disease.
So, Dr. Aggarwal, now things are coming back to normal in many places. At least, I think the area which you are practicing in are relatively, under control. Not to talk about Delhi. So I'm sitting in Delhi. So Delhi, we can't say that we are coming back to normal.
Actually, sitting in Delhi, everything looks normal only. So, because I think Delhi is the most affected area in comparison to Delhi, each and every part of this country will look better only in numbers and
much
outcomes.
better now, and we can safely say that it is coming back to the normal.
Correct.
So when things are coming back to the normal, what is the impact of pandemic now you are seeing in the area of cancer? Because globally we see that there are studies, researches saying that people have delayed their diagnosis, people have delayed their screening, people have delayed, or sometime also kind of discontinued their care also. So do you also see that it has added certain burden of the disease? Are we seeing more number of patient, more progressed cases, of late?
See, of late, it is too short a time interval to assess those things in a very systematic manner. But yes, there has been delay. There are patients who, actually, I practice in a Tri-City, Chandigarh, Panchkula, Mohali. So many patients come down from Himachal, and people who are far-flung areas, traveling was a difficulty, state transport was not available. Every time doing a private taxi, coming for a chemotherapy cycle and going back is very taxing economically also. And we all understand that, not only health-wise, but economics also has been affected very badly in this pandemic. So in general, yes, there has been a delay. In general, many people have faced difficulties. And when very other point, very practical, is that the government institutes were also closed. The normal OPDs in, say, PGI, Chandigarh, government medical colleges were closed. So people who were taking treatments at PGI, it is difficult for them to maintain the same schedule because the number of OPDs being seen by the doctors there is reduced or limited. So then they tend to move to private setup, or they tend to take help in private setup. So number of cases definitely have increased. The burden is more, but the exact assessment of this is probably down the line we will be able to know more about it.
Dr. Aggarwal, these months of October and November, they are very considered very critical and important in the, I think, the world of cancer care. We see, these months are also awareness month for many cancers. October was breast cancer awareness month. Along with that, also liver cancer awareness month. November is for your lung cancers, pancreatic cancer, and also I believe prostate cancer. So, and today is actually International Men's Day also. Prostate cancer is associated with men. What is the prevalence of these kind of cancers in northern India, especially in Punjab, Haryana, Himachal? The areas which you cater to.
So lung cancer and prostate cancer are very, very common in our area. And lung cancer is, generally we used to consider that associated smoking was the most important risk. But nowadays, non-smokers, female who have no exposure to, say, tobacco per se, they also are getting lung cancers very commonly. So in these times, the prevalence has increased. The new risk factors, which probably we don't know of those risk factors also, they are coming up. And, people are getting diagnosed. And but one thing in lung cancer which has happened very nicely is that the treatment advancement has happened by leaps and bounds. In the last 3 or 4 years only, I see the landscape of the treatment being changed dramatically. And we are moving towards more precision. We are having more advanced molecules, immunotherapies. And that way it is a good thing. But again, the prevalence is on the rise. Similarly, prostate cancer also is very common in our area.
What are the probable causes for prostate cancer? Like we consider lung cancer primarily being caused by smoking or other pollutants.
If you see the textbook definition of risk factors for prostate cancer, the most important risk factor is African American race, which we don't see in our country. Secondly, family history of prostate cancer is very important, again, which we don't encounter very commonly. In the absence of these two factors, also, we see so many prostate cancers. So if you ask me what is the exact reason for so many prostate cancers in our country, I really don't know. But, general age is one of the risk factors for prostate cancer because it is definitely a disease of the elderly. Plus, chronic infections or a family history of prostate cancer could be other important risk factors for prostate cancer.
And what is your opinion on this pancreatic cancer? Is it a rare kind of scenario or?
No. Pancreas cancer is a common, not as common as breast and lung cancer, but yes, it's a common malignancy. Unfortunately, pancreas is the disease which is considered one of the worst cancers in the body to have. Because despite our best efforts, despite the advancements in medical fields, the outcomes of these patients have not been great. So life expectancy is limited. The complications during treatment is not much. Patients come at a stage where the general condition and well-being of the patient is already hampered, affected badly. And not many patients are able to complete the treatment that we plan on paper. So pancreas cancer is a very bad disease to have.
Is it, so there are not much early signs to spot that pancreatic cancer, or it is because, people ignore that? Why normally they come in the advanced stage?
So pancreas is a very small organ lying deep inside your body. So, like breast is very commonly detected and seen because it is a superficial part and ladies are aware. Now, pancreas has to grow by a significant size in itself, or the tumor has to grow itself by a significant size to cause, symptoms. So suppose if a mass of 3 to 4 centimeters is there, then only it will lead to obstruction, pain, whatever. So the symptoms which it will produce, those are very variable. So sometimes, it will only cause pain, abdomen, and jaundice. So now stomach pain and jaundice is a symptom which can be as common as an infection to as serious as a pancreatic cancer. So, and there is such an overlap between these symptoms that, we keep the suspicion for pancreas cancer low because you don't directly start investigating for pancreas cancer. So, the symptoms are not very specific. The suspicion is also not very high for each and every case. As I told, the symptoms are not specific. Plus, the especially in our country, there is you see that first the local doctor, then some Ayurveda hair or herbal medicine treatment, then they go to some government hospital or private hospital, then somebody will advise a scan, then they will take their own sweet time to decide whether they need that scan or not. Then when they think that yes, now it is beyond all this, now we really need some help, then only these patients turn up to a proper center where the care can be done. And by that time, most of the times we have already lost the battle.
Though by mentioning about people doing that treatment shopping from Ayurveda to many other those streams are available. It tempts me to go to our main agenda and the key topic of today's discussion, which is about myths and the multiple uh, kind of misgivings which people keep in their mind when it comes to cancer treatment. But let me just ask one more question. Now, October was liver cancer awareness month also, and Punjab and these surrounding areas, definitely we have seen that there have been large number of or higher prevalence of liver diseases because of your hepatitis and multiple other. Uh, what is your opinion on that? How much liver cancer is impacting people there, and what are the probable causes?
So probably the most common cause for, as you rightly mentioned, liver cancer is hepatitis and hepatitis B and C. Now, if you see the if you see the geographical distribution of the spread of cases of hepatitis C, you will find that Punjab is one of the worst affected areas. Now, patients also tend to consume more alcohol, and all the risk factors, alcohol, hepatitis B, hepatitis C, they all are very prevalent in this area. And also obesity, also turns up as a risk factor sometimes. So combination of all these 3 or 4 factors, alcohol, obesity, hepatitis B and C, these are the most important risk factors for liver cancer, and they all are very common in Punjab. So that is why probably we see very commonly liver cancer cases in this part of the country.
What can be the common advice for all these kind of for as far as the prevention is concerned, and also if there are higher risk factors, so timely checkup and timely diagnosis?
See, one risk factor which probably is linked to every cancer is tobacco in any form. So you see, cigarette smoking, BD smoking, tobacco in any form consumption is one of the most common risk factor which you can attribute it to any cancer. Start from your head and neck cancer, cancer of the mouth, cancer of the food pipe, stomach, everywhere. Tobacco in any form is one of the most important risk factors.
Apart one from thing which has come into the kind of vogue quite I think extensively is that hookah and those kind of thing, which are younger generation is attracted extensively.
Correct. So if you see these hookah joints, they label it as tobacco, tobacco less hookah. They do some flavoring and all, but I don't know. Then again, if it is a flavoring, then addition of chemicals and all happens. So I am really not aware how safe those are for consumption. But smoking in any form or inhalation of tobacco in any form is one of the most important and serious risk factors. Then comes alcohol consumption. Then probably some radiation exposures, some chemical and pesticides use, plus obesity and what we call as physical inactivity. So these are the common risk factors where most of the cancers you can attribute to them for development of cancer.
So tobacco should be stopped completely.
So tobacco should be stopped in any form. It should not be consumed at all. Alcohol should be limited to, actually it should be stopped. Again, people come and ask us 1 glass per week, 1 peg per week, 2 pegs per week. So they have their own definitions for how much we should take and we should not take. But ideally, if better, it should be avoided. Plus regular food, regular walking, physical exercise. And these are the things which are in general good for health, lifestyle modifications. Plus it can go a long way in prevention for diseases as deadly as cancer.
What can be a preventive checkup or something which people should follow at least on, let's say, a certain interval?
So there is no generalized answer to that question, because prevention and screening is done on the cancer specific wise. So if you talk of the most common cancers, the most important screening manifestation of preventive test is mammography for women in breast cancer. So any lady who is more than 40 years of her age and till she reaches the age of 75, annually she should do a mammography, and that will help her in prevention of early detection and prevention of breast cancer. Similarly, for prostate cancer patients, any patient who is reaching his age of around 50 or 55, he should get his serum PSA level done once. And depending on his PSA level, we will decide his risk and then advise him whether he needs a repetition of this test or not. Similarly, for lung cancer, there are certain protocols which is called as a low dose CT scan, LDCT, which can be done for very high smoking index patients, which has proven to be beneficial. But again, there are certain malignancies like pancreas cancer, GI tract cancers, liver cancers, where screening and early preventive measures have not worked out so well. So we don't advise them for the general population to undergo these tests very commonly.
Thank you so much, Dr. Aggarwal. You have described things quite, I think, in a much more simplistic manner to understand for our audience also. Now let's talk about that. What are these myths which surrounds the whole cancer treatment? As I said that the moment people get to know about it, you get to see so many advices coming from all sides, uh, and for everything. So, what are the most common cancer myths you might have come across during your practices?
So, myth, I see variety of patients from different, socioeconomic state and education state of the society. So from, somebody recommending them not to undergo a simple needle test or a biopsy for diagnosis, because if you touch that tumor, it will spread, to not consuming milk products, to not consuming ghee, butter, to stop consuming, paneer, to start taking some ayurvedic medications along with chemotherapy. So there is no end to the list of the myths that we encounter every day. So the out of all those, see, dietary and all are things which are patient's choice and patient's perspective, and we might differ on that. But one question which I will like to emphasize and I will like to make very, very clear is that patients do not undergo a simple needle test or a biopsy in the fear that if you touch the tumor, it will spread. No, that is a very wrong understanding and a very, very wrong notion, because people will move around with that swelling in their neck, hand, or wherever in the body part, but not undergo biopsy, because somebody has explained in the village that if it happens, if you touch that tumor and if you get a biopsy done, it will rupture or it will spread. Now, this is, there is no scientific basis behind it. And cancer is a disease that until unless you get a piece out of that, no diagnosis can be made. No imaging or no photograph can tell you that whether this patient is having cancer or not. So I see many patients who knew of their swellings or their lumps from 6 months, 8 months, 1 year, or even 2 to 3 years, but due to either social pressures or due to their own understandings or some misinformation from anyone, they do not want to get it touched, and they feel that now I think it is cancer, so it will turn out to be cancer. I have only 4 or 6 months remaining of my life, so I don't want to spread it, and so I don't want any treatment, I don't want any diagnosis. So that is one of the most common myths that needs to be.
So you are saying this is also myth that they have also assumed that since if I have cancer, I may be having only this much time left, so I don't want to touch it. It may be treated.
No, so most of the cancers, if you know there is a swelling, and if today's standards you get it, diagnosed properly, more than 90% chances are there that you will get cured of it. The problem with, see, I ask this question very commonly to my patients, that if you are labeled with hypertension or diabetes or any such disease, you don't go to a doctor and start asking how much months I have or how many years I have to live. You simply take a tablet and you live on for years. You don't live with years for so many years because the disease was good. It was because you were compliant with your treatment. You took your medicines regularly, you took your treatment, prescribed treatment regularly, and it was under control, so you lived for so many years. If you see a patient who is uncontrolled diabetic or uncontrolled hypertension, his chances of having a kidney failure and a heart attack are far more common and far more fatal than a cancer patient. But once the name of cancer comes in, they are having other thoughts in their minds. They will ask only two questions. खर्चा कितना आना है, गारंटी है कि नहीं?
और कितने दिन की है?
That is what. So the question is, I tell them that, see, my job is I cannot change the disease for the patient. I cannot change the stage of the patient. The only thing is that whatever best can be done today for him, let us do it. But again, then, the advisors, so-called advisors to the family, some people who have undergone these experiences before, or some thought processes, they come in picture, and then probably most of them, it is very difficult in India, especially to convince them to go for the treatment. Many people will think that his doctor is prescribing treatment because it is his benefit. But on the contrary, they have to understand that it has nothing to do with me. It is for their disease that we are trying to do something.
So along with myths, fear of cancer is also causing a lot of hindrance.
Yes, there is definitely a strong fear for this disease. And you have to understand that though there is, obviously, it's a life-changing diagnosis. There is no doubt over it. But if you get it treated or get it diagnosed at an earlier stage, many people live for many years with it. So it all depends on what type of cancer you are having, at what stage you were detected, what was the treatment you took, and what was the outcome of that treatment. So it is absolutely wrong to generalize the outcome of one patient to other patient. You go
every
to one
cancer is different. Every person is different.
Not every cancer. For stage 2 cancer patients cannot behave in a similar manner. If you come to my OPD, the opening remarks will be, sir, I am having stage 3 breast cancer. In my village or in my locality, there was another woman who was having stage 3 lung cancer. She took chemotherapy and she expired, so I don't want chemotherapy. So the answer is that we don't know what was the age of the patient. We don't know from where she took the treatment. We don't know at what was the volume of disease when she was diagnosed with the treatment. Was she a 40-year-old lady or a 75-year-old lady? Was the cause of death cancer or it was heart attack? So the question is that we don't know, but it is such a generalization in the society that she had breast cancer, she did not survive, so I will also not. And I think this needs to be changed.
And also along with this, that, as you are saying, that fear is one important aspect, and cancer behaves differently in different stages among different people. I think what is the role of the people's or the patient's own mindset? How fighting or resilient mindset the patient has, how hopeful he is or she is about the outcome. I think that is also a very important factor in the overall outcome.
Absolutely, no doubt over it. Because see, ultimately, if you sit with the patient, if you make them explain that this is the problem, these are the expected complications, this is the expected benefit, patient also understands. But the problem is that many people, they don't allow the conversation between a doctor and the patient, especially in cancer. What will happen? Patient will be shown to the doctor and tell them, sir, inko mat batana, aap humse baat kar lena. So what happens, that poor patient, he's sent out of the OPD, and 4 or 5 people will come inside your OPD and they will take a decision of whether this patient requires treatment or not. They will understand the side effects, and those side effects are not to be experienced by them. They are to be experienced by the patient. And that patient is totally unaware of what is the diagnosis, what is he going through. They will only go them, yes, doctor ने scan लिखा है, उसके बाद बताएगा. So that poor patient is only undergoing testing, and then some injections and treatment.
What is your so these are the important aspect, Dr. Aggarwal, and as also we are drawing to the close of this session. What are your a few line messages that cancer patients, whether you have got diagnostics, whatever stage you are at, what you must follow and what you should definitely stay away from?
See, few basic points which I think everybody knows, but again, it is my job to repeat them. You all should stop alcohol and smoking consumptions. You should adopt a healthy lifestyle. You should make lifestyle modifications which are permanent. I see people stopping for 10 days and then coming back with smoking double the number of cigarettes they were smoking per day. So it should be a permanent change which you can sustain over years. Then only it is beneficial. I don't want that you stop the alcohol consumption for 3 months and 3 months later you say that now I have stopped, again I want to start it again. So that those type of lifestyle modifications are not important and those will not help you. Secondly, I will like to very, very strongly emphasize that, especially to rural women in this country, do not be shy or do not be afraid of your symptoms. I know ladies who, tend to take every possible treatment before they land up to a doctor for the examination of a symptom. So, I don't know, it's a stigma. I don't know, it is fear. I don't know what it is.
Or the priority in the family.
Whatever.
Also.
Yes, that also. So whatever it is, ladies, especially ladies and elderly people, they should be more vocal about their symptoms. They should get themselves detected, and then probably cancer is not curable. It is not that cancer is not curable. It is at what point in that whole spectrum of disease that you were diagnosed, we decide whether it is curable or not curable. So I think don't label it as an incurable disease. Don't just make a deadly diagnosis stamp on a patient and leave him for suffering. We are having ways and means nowadays to help them, to control the disease, to at least help them for some months of their life, and let us all take that effort at least to do it.
Very important, and thank you so much, Dr. Chitresh, for highlighting this, and for all our audience and who will be watching this shows later also, please do keep in mind that cancer, having all its attributes and the fear which we have, but it is not incurable. There have been, or there are multiple and many kind of advancements in medical treatment with which you can cure cancer. You can live longer even after getting out of cancer. So fear, myths, stigma, all these need to be shunned, and we need to take up the treatment if we need, with the full trust and full compliance. So thank you so much, Dr. Chitresh, to be with us on this special show. And so here was Dr. Aggarwal from Panchkula sharing very critical information on cancer care, impact of COVID-19 and myths around it that we must avoid. And if you have more questions, you can send them to us through WhatsApp. To use it, click on the WhatsApp button of our Facebook page. Also, don't forget to follow us to stay updated on all that concerns your health and well-being. This program was supported by Silpa Pharmaceuticals under its public awareness initiative. And we will be back with our another special show on cancer prevention and care during COVID-19 next week, same time. So keep sending your questions and we will certainly include them in our next show. Till then, stay at home as long as possible or as much as possible. Eat healthy, sleep well, and keep giving your mind and soul the daily dose of positive thinking. And don't forget to maintain personal hygiene, social distancing to protect yourself and your loved ones from the coronavirus. So goodbye and see you soon.